Yes.
Easy's back. Now things feel right again. I think Dale Farlow's got our invitation this morning.
God, you did come to you this morning, dear Lord, with grateful hearts and thanksgiving for all your many blessings you've given each of us, and you've given Rotary and to also our nation. We're so blessed, and we so often forget that. We ask that you continue to bless each of us as we go through this season and through the new year. Remove hate from our hearts, and just make our nation one nation. And we ask that you bless the people who prepared this food and bless this food in our bodies, and bless your service. In Christ's name. Pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
of the things we think, say, and do.
Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned?
So Dale, you got a Rotary moment?
Yeah.
And you can't say this one again.
I was just entering.
During this season, I thank the Lord with Max on some of the mission trips, and every time I go, I come back thankful for just being in America, just being born in America. We are so blessed. You know, I come back and I think about it's so nice to have hot showers, hot water, clean water, and air conditioning. You know, there's just so many things to be thankful for that we live in this country.
Chuck, we got a Sergeant Arms report.
Yes, thank you, Dan. We have 35 Rotarians here today. We also have Troy Fee from Crescent Rotary here today. Troy. Mary Haybrock has a guest here today.
I do. This is an awesome guy I've met through real estate. He and his wife. He works for Johnson & Johnson. He's a medical device sales rep. He is married to Sarah, who's the most beautiful pregnant woman I've ever seen in my life. And they just had their second child this summer.
Does he have a name?
Yeah, oh, Gaston.
Gaston.
I'm sorry. Helen. This is one of my heroes. But yes, this is Gaston Purvett. I'd love to have him in the club.
And also, as Dan had mentioned, we have another special guest today who I believe that Dorothy was also responsible for bringing here today. Nisi is here as our guest.
Is Ashley, I want to say Ashley, so I don't believe we have a health and happiness report. And Dale, we have a website malfunction. So everybody that has a birthday this week, you get a pass. It's a year off, so just enjoy your year without getting older. Walt, we got a football pool?
We do. Actually, we'll probably do one for the bowl season, maybe we're going to playoffs or something. We're winding down to the end. And it's a good thing because you guys are getting worse. That was even possible. We had 7 players that scored 50% or less. 10 out of 20 was a big number. Flippy is working very well for Chuck. He's been 50% the last couple of weeks. He's doing much better. So, Dorothy, I'll ask if you can borrow his coin. There you go. Here's your duds. I know. Good for Chuck's record. That's 2 weeks in a row. Was 7 correct out of 20? It's hard to do, but you're there. Mike Allen, you're not here today, are you?
Yes.
You are? What are you doing right now? See, everybody else is done. Mike has been thinking about it. Everything else, guys are working on this too. Okay, that's good. Because you won. And got 16 correct. Let's see, 14 correct. I'm sorry. And that's a low for winter. So you know, it's out there, guys. There's a chance for everybody. Okay? Now, I've got a pullover, and I've also got a really fancy coffee mug. hot. That's gonna fit you, it's fine. It's hard, but it fits me, I already wore it twice. But I got a bad feeling that leaves second place with Buster, who beat out Dale Meltzer in the tiebreaker. Both you guys picked Oklahoma over TCU, but Buster, you were closer on points. Okey doke.
Wow.
Congratulations, but is this, did you donate
Yeah, I
this?
I need another one. No.
You know what, I got you covered, I'll get you.
It's okay, it's okay.
Okay, anyway, fill them out.
I'm just so proud to have my name on it.
Congratulations.
I don't see, well, there was still a couple of spots to sign up for bell ringing. We have almost every spot filled, but I think there were 2 last night I saw. So some we have a spot for a co-bell ringer, which is great because that's what we decided last year if we wanted to put spelling. So please take a minute today if you haven't signed up. You know what, this is an opportunity. Let's get that filled up. Guy, you want to say anything about the Christmas party?
Sure. You know, next week we don't have a meeting, right? So it's only our evening meeting. It'll be at Mike Conrad's house, and we have heavy hors d'oeuvres. It's not a sit-down dinner, so you know if you're
Not for
diet
75.
challenged, make sure you're got a little bit on the low there. We'll have wine, beer, and Rito's is the caterer, and then the following week is the 17th. That's here, this in the morning meeting, and they'll have Toys for Tots. The Marines will come. So we want to get a good showing. Everybody bring an unwrapped gift. We want to, it's our toy drive. So they'll have 2 Marines and they'll join us for breakfast. We'll have music, Buster Claus and James and all those guys will be playing for us. So it'll be fun.
I think it's sort of a quiet week here. I'm glad everybody's back. Everybody had a good holiday. Ralph,
Yeah.
Ralph has something.
Did
What could it be?
anybody get my email about the fundraiser?
Did anybody get the email?
No. I must have not hit send. That might have been it.
Chris got it.
Nobody will fit to it. Hey guys, here's the deal. I'm meeting after the meeting for a few minutes, more of a think tank type meeting. Please join me. We know how important this is to the Rotary, our Gate City Rotary. Like I said, I'll be glad to roll with this bad boy by myself, but just I need some ideas. All right. So I've got some ideas already. I just want to hone them in and make this thing happen. Again, I've got to probably have this thing buttoned up by the end of December. So stay after the meeting and help me out. Thanks, Chris, for getting my email. Did seriously no one else get it? No one at my table said they got it.
Every email I send you comes back, bounces back.
Well, I have had a change, but the email I sent it to was my normal personal email. So anyway,
All right, please stick around. We don't leave
I
Ralph.
was looking for it.
We don't leave Ralph unsupervised.
No.
Buster, you got happy dollars?
I got a lot of emails. I didn't get one from you.
I'll resend it again today and make sure it goes.
Happy dollars! All right. I was thinking I had something to say, but I don't have anything to say.
I got one, Buster.
All right.
Thanksgiving, my granddaughter came up, she saw my new beard, she was playing with it. She said, "You look like a movie star." I said, "Yeah, who's that?" And I really expected her to just nail me. She said, "George Clooney." And then I had to buy ponies.
Glasses. Yeah. We don't have an ophthalmologist in the
Well, I don't have a dollar, I have 4 quarters, it's kind of a side thing. I have resigned my job, I'm a free person right now. Maybe for a while, so.
This is a funny story. I'm cooking, getting the table ready for Thanksgiving, all that stuff going on. And I had 2 house guests. So they were, it's a beautiful day, they were outside. He gets a business call and he's on his phone, so his wife comes in and we're talking. And next thing we know, he is coming in the house was drenched. What happened to you? He says, well, I was texting on my phone and I fell in the pond. There were no fatalities.
What were y'all drinking, I think?
My happy hour is very basic. I was able to have my daughter fly back from San Diego. I hadn't seen her in 3 months for Thanksgiving.
All right, so Kaylee had back-to-back tournaments. Last 2 weekends, back-to-back soccer tournaments. Her team won both tournaments, and in 8 games, she gave up 4 goals total. So, very good.
All right, this is a follow-up to my earlier happy dollar that my daughter-in-law is pregnant. On Thanksgiving Day, we had the reveal party, cake, and so we had to decide, was the icing pink or was it going to be blue? It was pink.
All right.
Very nice. I have one. Dennis Newman reminded me of the article in the Triad Business Journal this past week about Lewis Storage has become Lewis Logistics, and it's the company's been around since 1948. It's Lewis Storage Company, but as times change, we get calls every day from people going, yeah, how much is a 10 by 10? And so I used to try to explain to people, we weren't a mini storage company, and finally I came up with this great plan, which was they'd call, how much is 10 by 10? I said, we don't have anything that small. And they would say, well, what's the smallest thing you have? And I'd say, 40,000 square feet. And then you could hear them in their head, trying to calculate.
Can I get a couch in there?
That's like 15. And they would say, well, how much is that? And I'd say, well, that's $15,000 a month. And then they go, oh, thank you. And they would hang up. But my father did not want to change the name of the company. So, but it is, 10 years ago, I registered the domain name Lewis Logistics. So we're changing the name. It just reflects more of the total logistics services we do with freight management and warehousing, distribution, and inventory control. So it's been a lot of fun. And the great thing about the Triad Business Journal, they've got these young reporters. These people have to crank out the articles. So if you ever have anything you want your business to be known for, you just send them a little message and say, yeah, we bought a new copy machine. And man, they're just writing a whole article on your copy machine. So yeah, that was fun. I must admit, Grandpappy, he's really slack this week. Anybody's Grandpappy? Bobby, no Grandpappy. All right, sorry. I'll double down next week. I'm writing a term paper, so for a class, so Grandpappy sort of gotten shoved over.
When is it due? When is the paper due?
Saturday. Anybody got any topics on logistics that they game changer? Yeah.
There you go.
Chris, you got
You do.
I'm like George Thorogood. I eat alone. I'm sitting back here.
Hey, Ralph, just word to the wise, don't ever put fundraiser in the email. Everybody's got that filtered out. It goes straight to
That's why we didn't get it.
anywhere in the body, so just don't do that. Free Christmas. Yeah, put free tickets or something like that.
Only the former fundraising
All right, so we have 2 guests with us this morning. Sherry McMillan is here. Thanks for being here. And we also have our speaker, Dr. Martha Perry, who is an adolescent medicine specialist and serves as the medical director of Cone Health Center for Children. This center offers healthcare access, or a healthcare access point for under-resourced children and their families. She also serves as the medical director for the Cone Health Medical Group's Pediatric Care Division, which is a multi-specialty group of pediatricians. She is one of 3 board-certified adolescent medicine specialists in North Carolina. She is a native of Massachusetts, where she developed an interest in HIV/AIDS prevention during high school. This interest continued to drive her through medical school and beyond to become an adolescent medicine specialist. She earned her BA from Princeton. That's Princeton, guys. So all you proud Carolina grads. Where she majored in psychology. Dr. Perry completed her medical training at the University of Massachusetts Medical School and a pediatrics residency at the combined program offered by Boston Children's Hospital and Boston Medical Center. After a 3-year adolescent medicine fellowship at the University of California, San Francisco, and Boston Children's Hospital, she worked as the Associate Medical Director of the Boston Public School-based health centers and in private practice as a consultant for a variety of complex adolescent health issues. She moved to Greensboro in 2013 with her husband and 2 children who are 9 and 12. Dr. Perry is committed to helping parents better understand their teens and helping teens identify their strengths and talents. She provides teens and their families with medical management of reproductive health, mental health, and psychosocial issues. She serves as a Cone Health expert on topics such as long-acting reversible contraception, adolescent brain development, and anxiety disorders. She supervises the UNC pediatric residents during their adolescent medicine rotation and provides consultation services to any teen in need throughout Guilford County and surrounding counties. She sees her role in Greensboro as reducing teen pregnancy rates in the area while helping parents learn positive parenting techniques to form stronger relationships with their children. All right, it's all yours, Dr. Perry.
Thank you very much. It's great to be here. I am going to talk about the second near and dear topic to my heart. Adolescence is the first. And if any of you have adolescents and want to talk a little bit more about their brains and how different they are from ours and to better understand them, come talk to me afterwards. But today we're going to talk about the Cone Health Center for Children and a little bit about why we do what we do there. I'm going to just introduce it, give you a little bit of information about our history. We're going to talk about some of the predictors of poor adult health and how those can develop during childhood. And we're going to review the rationale for some of the services that we provide at the Center for Children. And I'm going to talk a little bit about a call to action for our community, how to address some of these needs within our community as individuals. So a little bit about the history of the Center for Children. We opened in February of 2014, so we're relatively new still. This was to increase access to the pediatric healthcare community because we had many underserved children who couldn't access healthcare elsewhere. Most of the patients have Medicaid or are uninsured. And as many of you may not know, if you were in private practice for pediatrics, if you were to accept beyond a certain number of patients with Medicaid, you would not be able to pay your bills. The reimbursement for the cost of the visit does not cover the cost of the visit. We wanted to also collaborate with many community-based organizations that meet the needs of our children most at risk to ensure that we're partnering as best we can and connecting our families and children with those organizations. One of the things that's really great about being a pediatrician is that almost all children have to see us at some point. They have to get shots to start school, so they end up seeing us at some point in the first 5 years of their life, often very frequently. And so we may be their only contact with the healthcare system or with any sort of public health system. And so it's really our job to be that conduit and connection to other services that they might need. And finally, we wanted to create a teaching environment to support future leaders in pediatric healthcare. We are a training site for UNC pediatric residents. We have 12 residents that are based out of our clinic, and they needed a good training site to continue training, not just in terms of pediatric primary care, but again, in ensuring that we can deliver healthcare effectively to all patient populations. So we started small. We started with 6 primary care providers, 2 subspecialists. We had 5 staff members. We had 6 exam rooms. We were actually using hand-me-down furniture at the time, and we had 10 visits on our first day. We were part of a clinic in Guilford County that had major downsizing, and so Cone Hospital Cone Health as a system decided to open this clinic, but we had very short notice in terms of identifying that need and going forward with that. So we had about 10 days to actually plan the opening of the clinic. And we grew rapidly. So we now have 12 primary care providers. We have 2 subspecialists. That's myself as an adolescent specialist, and we have a developmental behavioral specialist as well. We have 20 staff members. Actually, now we have closer to 40. In the last few weeks, we've hired a substantial number more. We have 27 exam rooms, and we had 20,000 visits in the past year. So that's pretty rapid growth. It's been hard to keep up, to be honest. And I want to talk to you a little bit more about some of the other essential elements of our clinic that really makes it special and unique as a pediatrics clinic. We have a behavioral health clinician on site that provides our patients with mental health needs with immediate interventions if needed. We have a parent educator who helps our parents learn more about positive parenting techniques. There's a lot more evidence now related to positive parenting and its impact in both short and long-term health and well-being of children. We have a nutritionist on site that can give guidance to families around basic nutritional needs. We have a financial counselor on site that provides information about insurance in terms of what patients are eligible for, how to apply, how to handle. Many patients don't seek care because they're worried that they have bills to pay. And so their health care needs go unmet until it becomes a crisis and they're in the emergency room. So we would rather pay a financial counselor to be in the office and help them through that than pay for a much more pricey ER visit when they're in a much more severe condition. We have a care coordinator who helps our patients with subspecialty referrals and referrals to those community-based organizations that I talked about. Many of our patients have inconsistent or unstable housing or inconsistent phone access and things, so we need to be able to help them with making calls and setting up those appointments and ensuring transportation, and so our care coordinator does a lot of that. We also have an interpreter. About 50% of our patients speak English as a second language. Majority are Spanish speaking, but we have languages including Swahili, Burmese, a variety of Pakistani dialects, Nepali, you name it. We have a lot of Arabic speaking patients as well. The list goes on. And we have a literacy program. There's an evidence-based program called Reach Out and Read that recognizes that encouraging parents early in life to read to their children improves their preparedness for school. It's been a long-standing existing program that actually was started originally at Boston Medical Center where I did some of my training. And basically a pediatrician gives board books that are developmentally appropriate to parents to read to their children during each well-child visit. It's a small thing, but it has had significant impact when you look at the literacy skills developed in those when they did a randomized controlled trial, looking at those who received those books compared to those who didn't. There was a difference in literacy preparedness for school. And those children, oftentimes their parents may not be able to read English or may not be able to read very well. But the interesting thing is it doesn't matter if they're reading the words on the page, if they're looking at the book with the kids and telling a story in whatever language and pointing out pictures, that's still helping develop their preparedness and their literacy skills. So a lot of people ask, well, are you providing health care or social service? As there's a lot of social service that I just mentioned. So what I want to talk a little bit about is the damaging exposure that we now understand impacts a lot of adult health, and it might help all of you understand why we do so much in our clinic. So in the mid-1990s, the CDC and Kaiser Permanente partnered to study the leading causes of death in adults. And they identified an exposure that increases risk for 7 out of 10 of the leading causes of death in the United States. At high doses, this exposure alters brain development, the immune system, the hormonal system, and it actually can alter DNA expression. There's a 20-year difference in life expectancy to those exposed at high levels to this versus those not. When you look at adult health outcomes, when you have exposure to you have a 220% higher likelihood of having ischemic heart disease, a 1,220% higher likelihood of suicide, 420% higher likelihood of Alzheimer's. You can see, obviously, higher likelihood of a lot of poor adult health outcomes. So what's the exposure? Anyone
today?
Lead, smoking,
Poverty.
poverty.
Then,
Well, it's having been exposed to 4 or more adverse childhood experiences. So what are adverse childhood experiences? Some of you mentioned them, but they're very specific. It may be physical, emotional, or sexual abuse. It may be physical or emotional neglect. It may be living with someone with mental illness, having an incarcerated relative, living with someone with substance abuse issues, experiencing divorce as a child of parents separating, or experiencing parental discourse, is being a witness to violence. These were the adverse childhood experiences that were evaluated and looked at in that study. However, we've come to recognize several others, including exposure to bullying, as well as exposure to discrimination. Certainly, poverty is a factor. So these experiences during childhood generate a physiologic stress response. And this has been always the missing piece for folks. Why would stressful exposures as a child mean that you'd be more likely to have Alzheimer's? I don't see the connection. But it's because there's a physiologic stress response when you're having these repetitive exposures. And as the number of those ACEs increases, so does the risk of all these negative health outcomes. Because you're having an increase in your cortisol level, you're having an increase in inflammatory markers that are in your body that normally are there to fight infection but are there when they shouldn't be there. You have, as I mentioned, a difference in how your DNA is methylated based on your exposure to stress. So some people then will say to me, well, bad environment, you develop bad behaviors, and that leads to bad health, right? It's probably because all these people are smoking, right? Or their parents drink, so they drink. Is that what it is? Well, let's talk a little bit about stress and what the stress response is. So if you're out hunting and unfortunately you encounter a bear and the bear is chasing you, what's your body going to do? So you're going to run, but your body has a physiologic response to that. Your heart beats faster, you produce a variety of different hormones, norepinephrine, cortisol, because you're running away from that bear scared, and your body is making sure that you're running scared. So there's a multi-organ response to that stress. Well, what happens if that bear lives in your house? You're having that physiologic experience every day. So you go into this chronic fight or flight mode. You have chronically elevated hormones that are only supposed to be elevated in times of stress. This repeated activity causes your hypothalamic pituitary adrenal stress response system to go into constant operation. You have increased inflammation, which means that your arteries are going to accumulate more plaques and get thicker faster. That's part of why we develop ischemic heart disease. Your DNA expression is going to be altered. Your developing brain is going to develop in different ways based on all of those hormones that are present and being in that constant fight or flight mode. So these all lead to these poor adult health outcomes that we talked about. What's really interesting is when they looked at this study, even when you control for the unhealthy behaviors. So if you're studying this and you control for smoking, drinking, high-risk behaviors, there's still a risk of having these poor adult health outcomes based on these exposures. So even if you're exposed to all these things and you grow up and you have good behavior, you're still more likely to have these poor adult health outcomes. One of the things that people have asked, well, how common are these? Well, first of all, the study that was done with CDC and Kaiser Permanente was done in a middle and upper middle class, predominantly Caucasian population. So as you can see, 61% or almost 62% of adults in California had experienced at least one adverse childhood experience. And 1 in 6, or close to 20% really, had experienced 4 or more. This the top most common one was emotional or verbal abuse. That's something that's really hard to detect and pick up because it's very subjective. Parental separation or divorce was the second most common one, and experiencing substance abuse in the home was the third most common. So one of the questions that we always ask is, what can we do about this? You know, there's stressful events going on in the home. This is causing a physiologic stress response that's damaging the internal organs and leading to poor adult health outcomes. How can we address this? We can't change the home situation. So what would mitigate this? Well, there's some interesting models out there, and there's been some animal models that have been studied extensively. And what we know is that if you take a mother and her pups, if you're studying in rat models, which is frequently studied looking at stress response models because of a similar physiologic response in rats compared to humans, I don't know why that is, but if you look at rats and you expose them to stress, or what would be considered stress for them, the mother that licks her rat more frequently, the child who is licked by their mother more frequently, the pup, has a better outcome. They're exposed to the same stress, but just being licked more often by the mother rat mitigates that physiologic stress response. So those hormone levels are lower in those pups that are getting licked more often. So parent skills training is at the top of our list. Many of our patients and their parents have experienced stressful events as children, and how those stressful events were handled can be very different. And in many families, authoritative versus authoritarian parenting style is one of the big issues. So if a child misbehaves, yelling at them and telling them to go in the corner is how many of our parents are taught to manage behavioral issues. But if you're approaching it in a more nurturing manner, that stress response that they're having because of all the other stresses in their lives may be mitigated. Some of what we do is try to also reduce all the other outside stressors that we see. So that care coordination becomes very important. That life stress reduction becomes very important. Taking away some of those stressors that can produce some of the adverse childhood experiences at home are very important, and there are things that we can do by easing access to transportation, by ensuring stable housing, by helping with literacy and language. One of the things that I find really fascinating is that many of our parents respond extremely well to just educating them about the response that their kids are having to stress, and that means that it's changing their bodies and their organs, and those changes are permanent. And that means when they grow up, they might be much more likely to have the same health problems that those parents have. And that there's something that they as parents can do. And it's something really simple, which means hugging them more, coddling them more, reading to them more, spending more quality time with them. That's something that's often very surprising to our parents, that they can change the future physiologic makeup of their child's body and their ultimate adult outcome just by hugging and touching their child more. Nutrition support is obviously one of the very important things as well. And our behavioral health interventions are a big part of what we need to do in terms of helping our families cope with those everyday stresses. There's great data out there on adult health outcomes looking at, for instance, thickness of the arteries. Would you be surprised if I told you that there is evidence that meditation can reduce arterial thickness? So that's because, again, there are things that we can do that help reduce our physiologic response to stress and lower those cortisol levels and lower those inflammatory markers that have nothing to do with our Lipitors and our lisinoprils and our other medications that we take to reduce some of those damaging health consequences. So I just want to tell you a little bit about a typical patient in our clinic. A 9-month-old comes into the office. She's got a fever, congestion, she's pulling at her ears. She's got an ear infection. We see that a lot. We prescribe antibiotics. We're all done, right? Pretty simple, straightforward. Well, let me tell you a little bit more about this patient, who's a typical patient of ours. Mom is Spanish speaking, a single mom with post-traumatic stress. She didn't finish high school in her native country. She works 2 jobs that are below minimum wage paid. She has no car, she has no health insurance. She has 3 other children and a sick elderly parent living in the home. Her electricity was recently turned off after being unable to pay her electricity. So I heard a comment earlier about coming back to this country and thinking, wow, we're so lucky because we have air conditioning and running water and all those things that are basic needs. Unfortunately, there are many families in our own community right here in Guilford County that don't have those needs met on a regular basis. So what's needed in this case to get her ear infection treated? Not just prescribing antibiotics, as is typical in our family. She needs health insurance or some sort of coverage of the antibiotics. She needs transportation not only to get to clinic for the diagnosis, but also to get to the pharmacy to pick up the prescription. She doesn't have electricity, so the antibiotic that needs to be refrigerated, how do we do that? Making sure that that's set up. We've got to make sure that the prescription instructions are translated and written in very simple language. We've got to make sure also, this is a 9-month-old who doesn't want her medicine. And how do you parent a child and get that medicine in a very resistant toddler? In a parent who may not have had some of the basic parenting skills training that many of us take for granted. And in addition, we're always about intervening for chronic stress. Maybe this child would have fewer ear infections if the stress levels at home were lower. So that's where we have quite a team, as I mentioned. That's where team-based care comes in. Because in order to make sure that that ear infection is treated, we need our parent education to explain how to deliver that medication to a resistant child. We need that care coordination for transportation. We need to make sure we've got insurance coverage. We've got to make sure that we've translated that prescription into a language in a way that's understandable. We've got to make sure that the refrigerator is on and that there's food to take with that medicine, and make sure that behavioral health interventions are always in place, again, to think about that chronic long-term stress that that child is experiencing. Oops. Nice special effects. So that's where I come in to talk a little bit about a call to action to all of you. I want to talk to you a little bit about children in Guilford County. 1 in 4 children live in poverty in Guilford County. That's higher than the national average of 1 in 5. 1 in 4 children experience food insecurity. 1 in 5 children experience housing problems. There are 11,000 uninsured children and 70,000 who are insured by Medicaid. We have 6 full-time, the equivalent of 6 full-time providers in our clinic. And the typical patient panel size is about 1,500. So we can handle about 9,000 patients. That's just a small dent in that 70,000. So what I'd ask more than anything is to be aware of what's happening in our community and what the needs of our children are, and also to think about doing your part to mitigate adverse childhood experiences. One is to really educate your fellow community members about the impact of chronic stress and how chronic stress turns into toxic stress and is the reason that we're seeing adults have lower life expectancies than we would like. The reason why we're seeing adults have heart disease and Alzheimer's and many other chronic health conditions. Learn and model stress reduction techniques. How many people here practice some form of stress reduction? Okay, so that's pretty good. Maybe a third of the room. But it's one of the most important things you can do for your health, as well as that you can teach those around you to do. Many of you were probably exposed to at least one of the adverse childhood experiences that I mentioned. And that has an impact on your health now and could have an impact on your children's health. Find a way to nurture and support youth in your community. What we know is that we can mitigate that toxic stress response just by providing more nurturing. So if a parent isn't able to do it, perhaps we can in some way, as a mentor, as a teacher, in some way teaching parents how to provide more nurturing support to their children. It's hard to be supportive and patient with your child when you're under stress. So imagine this mom that I mentioned earlier, and then we're telling her, can you vacation and hug your child more? And so we've really got to figure out how to support her and help her be able to do that, because you know that's going to have the biggest impact on her child's future health. So this is one of our youngest trainees in the clinic. But what questions do you have?
What year did the Kaiser Permanente study begin?
It began in the 1990s. But a lot of it looked at retrospective data. So it's not a prospective study. So it was a massive survey of I believe it was 70,000 people. There's still research reports coming out looking at the findings. The American Academy of Pediatrics has now put toxic stress and its impact on future adult health is their #1 priority because the data is so compelling. I think that it's one thing to say that if you live in stress that your future life might be impacted, but I think it's another thing to realize how much physiological impact that has, and that it's not just learned behaviors, it's not just that you learn bad behaviors from your parents, but that you actually have thicker arteries and a different brain in terms of how it operates, and a different kind of immune system based on your exposure to stress. So it's, at the most recent national conference, it was the most talked about subject, and it really should be the top priority in any community in terms of thinking about long-term adult health. We're really trying to push Cone Hospital as a system to look at this more in depth, because so much of our healthcare system is about responding at the end as opposed to the beginning. And I think that, again, having some scientific evidence behind this might be more compelling. It seems kind of obvious sometimes, but I think that understanding the physiology behind it really helps compel folks even more so to take action. We're still working on building evidence around how to address this. But what we do know is that it's a little more basic than you might believe, and that it's about how parents react to stress, how parents treat their children. And if they nurture their children, they could be exposed to violence and they could be exposed to a variety of stressors, but if they have a nurturing parent, that is enough to mitigate that stress response.
How do you measure whether your program is successful or not?
Well, for us, we're still working on that. We are basing what we're doing on evidence that's already been gathered. So the parenting techniques that we use, one in particular, which is called the Triple P, has been extensively studied, and there's really strong evidence to support its effectiveness in changing parent interactions with their child. We also use a more intensive therapy called parent-child interactive therapy for those families that don't respond to Triple P guidance and need more intensive training. And that actually involves a parent and child interacting with a one-way mirror where a trained specialist is on the other side and in a headphone coaching the parent on how to interact with their child in a play mode, and coaching on how to deliver positive parenting techniques.
And also, how long do you, once a person comes in, a family, a child comes into your program, how long do they stay?
So our patients are coming to us for their primary care. So we take care of them from when they're born to age 21. We see them in the first year of life multiple times. We see them at when they're born, a week after they're born. We see them at 1 month, 2 months, 4 months, 6 months, 9 months. The typical well-child visit. So again, because there's so many vaccines and developmental reasons for a child to be in seeing a pediatrician, it's an opportune time for us to provide some of these interventions. And so we continue to follow them. And along the way, we screen for these risk factors. We screen for maternal depression using, again, validated screening tools, as well as screen for behavioral issues in children and developmental issues that start to present very early on as a consequence of some of these things. And then there are, again, evidence-based interventions that we can use to help address some of those issues.
So how do you get this this message out into the community, especially, you know, community-based efforts that are touching people's lives all over town, both from the community sector, faith-based groups, that sort of thing. How do you get that message in their hands so they can use it?
Well, that's part of why I'm here, is because I'm hoping that all of you can help with that. You know, you don't have to know all the science behind it. I left a lot of that out even today. But to say that we know without a doubt now that there's a physiologic response to stress during childhood, and that if we nurture our children more, that we can mitigate that stress response. I feel like that is all you need to say. And that can open up a discussion that can lead to, okay, well, what do we do about this? And how can we manage it? And knowing that there are specific parenting techniques that can be very helpful, as well as well-recognized stress reduction techniques that are also helpful, not only in children but in adults, can make a big difference. I've talked to a lot of the cardiovascular folks at Children's, the vascular surgeons, at Cone, I met the vascular surgeons about this, and it's a little bit intimidating for them to know that, you know, there are studies that will prove that meditation can have some of the same impacts that they can have surgically or certainly with medication. But they're on board too, because they would really rather someone get better using those kind of techniques than go under a knife and have a lot more potential risks with that. But it really is about getting the word out. A lot of it is going from place to place. There are a number of speakers traveling nationally now talking about this, but it's word of mouth. I think that it should be a public awareness campaign, but we haven't been able to get anyone at a national level to take that on yet. But certainly the American Academy of Pediatrics, which is a large, somewhat influential organization, is really pushing it now as their #1 priority. So I think that if you look at news stories compared to the early 2000s to now, the percent of stories have gone up dramatically. So we're hearing more and more about it, but we've got to keep talking. We've got to keep educating each other.
Perry, thank you so much.
Thank you.
Quite appropriate this morning, dinosaurs in the supermarket, we're going to donate in your honor to Cone Elementary. So thank you.
Awesome.
We have one job for you. High stakes raffle here.
And this is my contact information. If anyone wanted more information, or you have other groups that you think might benefit from hearing from it, email me and we'll set something up.
If you would draw and just read the last